Okay, my name is Sammy Orby, and my Communicable Disease project is on Klebsiella. Next. So what is Klebsiella? Klebsiella is an antibiotic-resistant bacteria that is known for causing HIAs, or hospital-acquired infections, such as pneumonia, meningitis, sepsis, and bloodstream infections. Next. How is Klebsiella diagnosed? Klebsiella is diagnosed by getting a sample of the infected material. So if it's meningitis, that'd be after a spinal tap. They'd see what bacteria is affecting the human body. If it's pneumonia, then that'd just be a saliva sample or something like that. They send it to a laboratory, they test the sample, and they see if Klebsiella is present or not. And in some cases with pneumonia, an X-ray may be administered to see if Klebsiella is present. Next. For disease transmission, Klebsiella is transmitted through direct contact, which means you have to come in contact with a surface or someone who has it, so it's not airborne. It's most likely or most commonly found in the ICU and where patients are using ventilators or devices that help sustain life. It can be found outside hospitals. It's not very common, and it can last for a very long time on surfaces if not cleaned properly, ranging from 2 hours to 30 months. If the surface is not cleaned at all, that's the 30 months case. Next. For relative frequency, it's normally found in hospitals, like I said, and in Western culture, it's approximately 3 to 5 cases of all, or 3 to 5% of all community-acquired pneumonia is caused by Klebsiella. But other than that, it's pretty uncommon outside of hospitals. In developing countries such as Africa and some parts of Asia here, you can see that it's very severe in developing parts like closer to India, and then in Africa, it's moderate. In terms of nosocomial bacteria infection, which means infection that's acquired inside of hospitals, there's not really a geographical difference between.
What is that blue spot right there?
Here?
No, below.
Here.
No, under the big one.
Australia.
No, right there. In the middle, the big blue, the double blue.
The one you pointed out?
South America.
The first one you pointed out.
South America.
Okay, I thought you said Africa.
Oh, yeah, sorry. What was I saying? Oh, yeah, it's responsible for 600,000 deaths per year, and accounts for one third of all gram-negative bacteria infections. And what gram-negative means is after a test they call gram staining, it's the color that appears after you test. So gram-negative just means that the color appeared. Next. For the disease course, it can be different depending on what the infection is. So for meningitis and pneumonia, the disease course is a little different, but it follows a general pathway. So symptoms appear after 48 hours, and depending on the site of infection, it can linger for longer or short amounts of time. It's very different. For complications, again, since there's so many things that it can cause, there's a lot of different symptoms that you can have, but some of the overlapping ones are fever and nausea. For meningitis specifically, there's a stiff neck, photophobia, which means that when they see light, they get a little dizzy, they get a little nauseous, and confusion. For pneumonia, it's chest pains, altered mental status, coughing, shortness of breath, and fatigue. For a surgical infection, it's redness, pain, and cloudy fluids coming out of pores. For a blood infection, there's chills, lightheadedness, low blood pressure, rapid heartbeat, skin rashes, and mottled or warm skin. Next.
What's the medical name for stiff neck?
I had it memorized when I first made this project, but I forgot.
Who want to help?
Charlie or nah?
No, it was the rigid or
Nuchal rigidity.
nuchal rigidity. Yeah. For the target audience, the median range for the age of Klebsiella infection is 72 years of age. So older patients are more at risk. For the environment, it's patients in the ICU and patients who are, nurses who are near infected patients. The lifestyle, alcoholics are at extreme risk because the alcohol that damages their liver, they're not able to produce the antibodies, or not antibodies, but they're not able to produce the defensive measures needed to fight off Klebsiella. And for the medical history, patients who use ventilators, patients who use intravenous catheters, and patients who use antibiotics frequently are all at risk for Klebsiella. For the treatment and prevention methods are frequent hand washing before meals, touching eyes, touching your nose or your face in general after coming in contact with someone in the hospital. After touching bed rails, you would wash your hands, wearing proper PPE like gloves, mask, face shield, gown. And the treatment for Klebsiella is just taking your prescribed antibiotic as prescribed and not going over or under, because, as I said, it's an antibiotic resistant bacteria. And then with my reflection, after conducting my research, I think the most important things to know are where it's found, which is in hospitals, how it's tested for, which is a sample of the infected body part. That is transmitted through direct contact, meaning it's not airborne. That is more common outside of hospitals in developing countries, and it's treated with antibiotics. That's all.
Any questions for Femi?
So you're talking about photophobia, right? So you said light in general. Is it flashes of light or constant light? Like if I walk into a lit room that's already lit, would I experience it?
It can be flashes. It's just the severity of light. Like if it's a smaller light, like a camera flashlight, maybe it's not that bad. But let's say some lights like these turned all the way up, then that would be what's causing that nausea.
So how does this research impact your future role as a future surgeon?
Since I'm going to be in the hospital working with patients, and this is a bacteria that's mostly found in hospitals, when I'm doing surgeries, I have to make sure that everything's like sterile and clean so that I don't have a situation where there's a wound or surgical site infection because of this bacteria.